The mission of the school is basically to provide basic and continuing education and further development in research.
Train veterinarians and equine dental technicians to work under the supervision of veterinarians to provide the highest quality equine dental care possible.
We want to help horses. I mean, that's what we're all about. Like, I love horses more than probably anything, so.
We run 4 different levels of dentistry instruction, okay? And so we'll run a basic introductory type course to train basic dentistry, and then we have a second level, then we have a third level, and then we have advanced level or continuing education.
We advise that they take the anatomy, the head anatomy, and tooth structure first. What that does is it gives you a background on, like, you can orientate yourself with what you're doing inside the mouth and why you wouldn't want to take structure off teeth.
After you become certified with the school, you can come back for continuing education to keep your certification up. We at the school think that's very important because if you go out and you're practicing without knowing the latest techniques and everything, that you might not be doing the best available job that you could. Continuing education happens at every class. You come back and you get your work critiqued just as you were when you first started out.
And we cater our program to the students, so if people want to go over at night, go over as their lectures, if they need help, we're willing to do that. So, because we want them to understand the foundation of the biomechanics of the equine dentition system. We want them to understand tooth structure. We want them to understand not just how to balance the mouth, but what that means to the whole head and how all the parts come together. So we have a strong emphasis on anatomy, physiology, biomechanics, and not just doing things, but we try our best to teach people why we do things and the reasoning behind everything, so that they can make informed, competent decisions when they're out in the field. And
instructors that are at this school basically have gone through this school, okay, and they're certified dentists that are in practice, and they've elevated to a higher level. Many of them are advanced certified dentists. So we will have different instructors at different times and during different classes. Some will be involved just in the continuing education classes. Some will be involved in the basic courses and lectures, depending on their ability to lecture and their ability to teach.
Clinical judgment is based on our diagnostic capabilities, so we've got digital radiography, video endoscopy, both rigid and flexible endoscopy. So we use the flexible endoscopy for looking at hyoids and guttural pouches, and we're also in the process of trying to obtain a CT scanner. So we document everything that we do here, so we take before pictures and after pictures, we take before radiographs, after radiographs, we take occlusal surface radiographs. So we've got a lot of different diagnostics that we use.
At this school, we developed a new system for effective nerve blocks on the dental arcades. So that's kind of changed a lot of ways we do things here, because now we're working on standing horses, and we can work on it for an extended amount of time, and the horse is very comfortable. Okay, we've developed different type of orofacial exposures for the sinus, for root canals, for different types of apical root abscesses, and so we have quite a few research projects going there concerning heat applied to the teeth, the amount of reduction, exposure to dentine tubules, pulp exposures, and what the effects are going to be from that.
There's a lot to know about the horse. We're never done learning about different anatomy, different techniques, instrumentation. Everything's always changing. That in order to stay up with this type of business, that there's always more knowledge out there that needs to be learned.
And that just coming to the school once isn't going to make you a full-on equine dental technician, that it takes a long time and it takes people coming back and furthering their education.
This is a rapidly changing industry, and so you need to be updated and continue your education for life, basically.